Thank you for joining us for the 4th Annual Global Summit on Kidney Innovations, Global Kidney Patient Voice, the Key to Accelerating Innovation, a collaborative partnership between the American Association of Kidney Patients and the George Washington School of Medicine and Health Sciences. My name is Kevin Fowler, and I'm a former board member for the American Association of Kidney Patients, and I continue to serve as a AAKP Ambassador for the state of Missouri. I'm also someone living with kidney disease, having received a preemptive kidney transplant in 2004. And based upon my experience of living with the consequences of polycystic kidney disease and facing the reality of kidney failure, my goal was to avoid dialysis by receiving a preemptive transplant. And my hope for all individuals suffering from kidney disease and facing kidney transplant is for them never need to go on dialysis and to receive a preemptive transplant, so that a preemptive transplant becomes more the norm rather than the exception as it is right now. And as a fellow patient advocate, or as a fellow patient, I have a deep passion for patient advocacy and patient engagement in the production and device lifecycle of novel treatments that answer the need and preferences of patients and their families. And those that are going through the journey of kidney disease firsthand, who really know what it's all about. This passion has led me into a career spanning over 30 years in both commercial and research and development roles for commercial enterprises. In addition to my role with the AAKP, I'm also the patient editor for the Clinical Journal of the American Society of Nephrology, CJSN. I'm also on the board of directors of the Kidney Health Initiative, which is a public-private partnership between the American Society of Nephrology and the US FDA. KHI has a mission to catalyze innovation and development of safe and effective patient-centered therapies for people living with kidney diseases. And for today's session on Global Kidney Patient Voice, the key to accelerating innovation, industry efforts across the globe advancing kidney patient care, I had the pleasure of conducting a series of interviews with national and global companies in the kidney space that are leading the effort to disrupt the status quo by making an investment in new treatments to address the many unmet needs of people living with kidney diseases, while also working tirelessly to integrate the patients and their unique insights along the way. In full disclosure, based upon my professional background working with life science companies, I have consulted for some of the organizations that I have interviewed. I enjoyed speaking with all these industry representatives across the globe and ask you to join me in watching excerpts of these interviews. Full interviews will be available post-Global Summit on demand on AAKP's social media platforms and YouTube channel. Thank you, and I hope you're just as inspired listening to these discussions as I was conducting them.
There are so many ways that we can engage patients. One is having more patients involved in lobbying the government regulators to look into some of the public policies that hinder innovation. Patients can become advocates through testimonials. So patients who have participated in clinical trials before can become advocates, because sometimes other patients need to hear from their fellow patients to gain that trust to want to participate in trials. Patient associations can also help to recruit participants in a study. That way, recruitment is not left just for physicians who are involved in research or physicians who are aware of a research that is taking place. Patients can also help in identifying research priorities. Patients can guide researchers as to what is really important to them, what it is that they need. Another important way that innovators can make use of patients is by creating what is known as the Patient Advisory Board. Now, the Patient Advisory Board can consist of patients, caregivers, family members, and advocacy groups. And this advisory group can be involved from the very beginning of a clinical trial in writing of protocols or reviewing protocols, where they can identify any difficulties that could prevent patients from either enrolling or participating fully in a trial. They can look at some of the literature, like the informed consent and other forms, and see how easy it is to read or understand. Things like trials that require so many follow-up visits may be a hindrance to patient participating fully, and including patients in the beginning. They can point out some of those barriers that may prevent a patient from participating fully. Some in this day of technology, increased use of technology. Another thing that patients can do from the get-go is identify complex technology that may prove very difficult for patients to use. And I believe that if patients feel that their concerns are being heard by researchers, they will be more in tune to participate in these trials and stay, because it's one thing to enroll them, but it's another thing to keep them and have them committed throughout the process. But I believe if they know that their concerns are being heard and they're looking into making it an easy process, not only would we see an increase in enrollment, we'll see a high rate of retention of participants in studies. Well, my impression on the role of a patient in clinical trials has not really changed over the years. And this stems back originally as a student of public health, where I was privileged to do some work with kidney patients on understanding the an informed consent. And the conclusion was that patients are needed to be involved from the get-go in writing the informed consent to make sure that they can read it easily, understand it easily. And over the years, working as a renal pharmacist, working as an ambassador for the National Kidney Foundation, as well as an educator for the American Kidney Fund, I have come to the conclusion that patients are absolutely needed to be more involved in clinical trials. We have to understand that the patient is the single most important stakeholder in our ever-changing healthcare system. We owe the current medical advances to patients who participated in clinical trials in the past. So therefore, it is very important that we encourage patients to get involved in clinical trials, because we do need research for medicine to progress. And without patient participation, there's no research. So I honestly believe that if we empower patients to assume a bigger role in clinical trials, we will end up with an increase in enrollment of patients in studies, as well as a high rate of retention of study participants. To put my company into perspective before answering that question, I would like to state our mission. So the mission for bioMérieux is to improve patient care as well as to protect consumer health through diagnostic solutions with high medical value. So there's several ways in regards to advancing kidney care. Our main focus right now is on acute kidney injury, or AKI, which is probably what I'm going to use from now on. And AKI is defined as a sudden decline in kidney function in 7 days or less. And we know that AKI, without early intervention, may progress to chronic kidney disease as well as other major adverse kidney events. So we identified that it is important to intervene early in a patient who's at risk for AKI to prevent the development of AKI. And we noticed that identifying patients at risk for AKI is an unmet clinical need, hence our innovation, which is it's a test which is intended to be used in conjunction with clinical assessment in patients who have or have had within the past 24 hours an acute cardiovascular and or respiratory compromise and are ICU patients as an aid to assess the risk of developing moderate to severe AKI within 12 hours of patient assessment. And that brings us back to our mission to improve patient care. Now, besides our current innovation, which by the way, we have on other innovations in the pipeline, which I look forward to speaking to you about it at another time. But besides our innovation in kidney care, we are also involved in creating awareness or AKI. One of the ways we do that is through provider education, where we partnered with Medscape to provide education. We participate in speaker series organized by the National Kidney Foundation. We engaged in face-to-face meetings with providers. We participate in seminars and webinars at congresses. And recently, we launched a survey where we surveyed over 1,000 primary care providers in US and in Europe to identify gaps in AKI awareness to help us plan better as to what we need to educate the providers. We also recently launched a global initiative to enhance patient value. And with that, we had two objectives in mind. One was to increase awareness of diagnostics amongst patient associations. And the other is because we recognize that it is important to involve patients in what we do. So the other objective was to have an opportunity to invite patients to be part of internal committees where their input can be utilized in our ongoing innovative solutions. We have a No AKI initiative that's on the way. And No AKI is in twofold. No with a K, as in KNOW, to know. So our goal is to make sure that everyone knows about AKI. And the other no is with the N, as in NO, because our goal is with early intervention, there will be no AKI. So it's really important. We take pride in advancing kidney care in any way possible. And one more thing, we do currently have another program where we give opportunities to patients to be able to express their experiences on our webpage.
I'd like to thank again the vast number of industry partners that took the time to sit down and have a discussion with me. Through AAKP Global, launched in 2019, AAKP is engaged globally because we are committed to educating patients, leaders, and companies across the globe on the importance of kidney disease prevention, new innovations in treatment, and the opportunity to save more lives. We believe that united patient voice can drive innovation and the policy decisions that determine timely regulation and payment for new and safe treatments. Globally, AAKP is working with patients, medical professionals, researchers, and medical industry allies, such as those you just heard from, to cultivate a united consortium led by patients. AAKP believes that this global consortium can advance innovation and change kidney care in countries where health systems or infrastructures do not support patient consumer choice or access to care treatments. Again, thank you to each of our industry partners for sharing with us the innovations their companies are working on or has available to improve kidney care from prevention and diagnosis to transplantation or access to care treatments.